everyone, and welcome to the InBizLV Podcast. I'm Mark Fierro, and today we're talking about the business of medicine and why it is sometimes so difficult just to get a doctor's appointment. Joining us today, Dr. Laura Addis. Dr. Addis is board certified in internal medicine and has been in the Las Vegas Valley for 17 years now. She is joining the Forte Family Medical Practice beginning October 1st at their Tropicana and Rainbow location. A quick point of disclosure, Dr. Addis is my fiance. Dr. Laura, thank you so much for joining us today.
Thank you so much for having me.
So, first of all, why does it take so long to get a doctor's appointment in Southern Nevada?
Well, we do, as you might be aware, we have a shortage of physicians and primary care especially, and a lot of doctors are not taking a lot of insurances. And I had this problem in the practice that I was in recently. I had patients waiting to get in to see me for 6 months. Fortunately, my new practice, I'm going to have an open door, and I expect to get patients in the same day, even the next day. I have the ability to work with my schedule that I didn't have before also. But it is a challenge, and there are a lot of doctors now that are busy, and want to see their patients and just can't get them. We need more doctors here.
Why Forte? Why did you make the decision to go with Forte?
Well, actually, I've known her now for about 15 years. I met with her quite a while back, but her personality is so warm and engaging. That was the first thing that I really liked about her. But also, her commitment to medicine is exceptional. She really always places her patients first. I know of an incident that happened where she was very upset about a patient's illness. And it was a day that I had gone to see her, and she was still a little rattled about it. And she's like I am. She cares about her people, and that's what made me really like her a lot. She really has a commitment to patient care.
You know, when we talk about what goes on in your day, it's really where the rubber meets the road in medicine. So much of the problems, and we hear heart attack, we hear stroke, we hear all, but the basis of all of it is diabetes. Diabetes is like everywhere now.
Unfortunately, it is. And pre-diabetes also. A lot of people are walking around, don't even know that they have diabetes or pre-diabetes. And pre-diabetes, you may not even see symptoms. You know, some of the symptoms of diabetes that we know of, we'll think of increased thirst, increased urination, weight loss. That's when your numbers are really high up there. But people who are walking around with blood sugars of 130, 120, that's not normal. And it's pre-diabetic, and it's still damaging the internal organs. The sugar levels in your body are supposed to be very well controlled to have proper brain function, organ function. So we have now a generation of young people. I'm seeing 5, 6-year-olds that are overweight, and it's the obesity problem that's causing this. We're not exercising, we're not eating well as a whole, and as a result, we're seeing more and more diabetics. Fortunately, there are things we can do for it, but if avoidance is the best thing, and, getting out and exercising, eating properly, and checking in with your doctor. A lot of times when people are told they're pre-diabetic, they disappear for a year. I've seen some patients that came to me as new patients in the last year or two that were told by previous doctors that they were pre-diabetic. And they came in for their yearly visit. I said, well, if you have pre-diabetes, you can't come in for a yearly visit. We have to keep an eye on this because the disease is very progressive and it can turn into full diabetes really quick. One of these patients, case in point, was told a year ago he had pre-diabetes. He came in to see me. His A1C was 9, which is rather high. And
what's a good number?
You want to be under 5.6. So 9, he's deep into diabetes territory there, and it's poorly controlled. He was shocked. He said, I can't be. I was told I was pre-diabetic. And it's true, but you have to keep an eye on it. And the first thing you have to do when somebody tells you there's a glucose problem, well, first of all, you have to look for it. But if somebody tells you, you got to get moving. That's the key. You have to move.
One of the things is when they say diet, the shorthand is just diet. I think what the average person hears is eat less. It doesn't make any difference if you eat less and you're having a Coke or a diet soft drink that doesn't have any calories. How could that possibly hurt me? Diet processed foods, tell us about how important not just volume, but what you're eating is.
Well, a lot of people think that if they have sugar issues that a diet soda is a good option. In actuality, it does trigger an insulin response, and it also makes you crave sugar. So there's that problem. But I will talk about a study that was recently published talking about soda, but how else do we do it? It's really just monitoring exactly what you're eating. And the things that are going to get us in trouble are breads, are rice, pastas, any of the starchy foods that we love. This is what tastes good. And it's not to say that you can't eat that. I always tell my patients, think of a plate. By the way, that's another problem we have. If you notice plate size, we used to have plates. My grandmother's plates that I took from her cupboard were about this big. And now our plates are this big. So our sense of proportion is totally off.
I always use that oval one. I like that one.
I know you do, and I have trouble getting it in the dishwasher. No, but portion size is so important, really. And also the content. You can have 2/3 of your plate filled with vegetables. You take 4 ounces of meat is all you need in a serving, and that's about the size of the palm of your hand. And it's a good guide to go by. And then if you want a little bit of rice or a little roll or a little piece of bread, that's okay. You don't need to have it all the time. However, if you don't have any starches whatsoever, you'll lose weight too. And it's choosing the right foods, choosing the right time of day to eat the foods. You can't have a big bowl of pasta and go lay down at night. That's just sitting in your body, all that sugar, and it creates some inflammation in your gut, which causes another problem, which I'll talk about also. But
there's a couple of books that really changed the direction of a lot of people's lives, and I don't think they're necessarily diets that you want to take on for the rest of your life, but it's a great way to lose weight for 2 or 3 months without any pain at all. One of them is Timothy Ferriss's 4-Hour Body, and the other one is the South Beach Diet, and it's basically don't eat anything that is or was white, anything that was processed, except for cauliflower and chicken.
Yeah.
And in the South Beach diet, you had people, there was this famous, the whole city kind of got together and everybody was trying to outdo each other and how much weight they could lose. It's unusual for a person to be able to lose 5 or 10 pounds and keep it off. They had people that were losing 35 pounds during the course of this contest just because they eliminated starch. They eliminated these other things. And once you do that, it's all of a sudden then you start watching things like soft drinks. And soft drinks are really one of the leading causes, aren't they? I mean, it's almost impossible to lose weight. You can exercise as much as you want to. You can cut back portion as much as you want to. But if you have a soft drink, even a diet soft drink, you're not going to lose weight that day, right?
No. Actually, you're going to do a lot of harm to yourself in other ways, too. I had, years ago, done some math, and I had calculated, based on calorie size, a can of Coke, 12 ounces, if you had a can of Coke every day and you gave that up, in 1 year you'd lose 25 pounds.
Yikes, that's all you need.
And more about soda is just in the journal, in JAMA, Internal Medicine, just published earlier this month, on the 3rd, I think it was. And it was a study that was involving 450,000 participants. And it was conducted over 19 years. And they found that people who were consuming diet soda had a significantly increased risk of cardiovascular death. People who drank regular soda had significantly increased risk of diabetes, obviously. But they also had inflammatory disorders of the bowel and the gut. It creates, the soda and the sugar creates like a leaky gut, and it causes inflammation in the inside of our intestines. And then you have problems with your intestines and issues with that. So the most startling thing of the study was, though, the cardiovascular risk from diet soda.
Yep.
2 cans of diet soda a day, people had a significantly increased risk. So there's no reason for us to be even drinking that stuff. It's bad. It really is. If you ever take a look at the chemicals that are in it. And plus, the other thing is you can't lose weight because it's chemicals. Your liver needs to metabolize poisons, toxins. It's one of the jobs that it does. And if it has to take a can of soda and go through all those chemicals, process them, it doesn't have time to do what it's supposed to be doing, breaking down fat cells. So we lose some of our liver's function because we're drinking that soda too. It's busy getting rid of all those toxins and things.
Getting rid of dead cells as well. It's supposed to be.
Yeah, it breaks down red blood cells. It does a lot of things. Busy liver we have.
The way it was explained to me is the reason that diet soda is so devastating is that it tricks your body. It essentially, you drink it, it tastes sweet. Mm-hmm. The second it hits your tongue is kind of the middle linebacker for your pancreas, and it says, okay, guys, bring some insulin, bring it, because we just took on a ton of, and so think about this, and correct me if I'm wrong, once your pancreas shoots that extra insulin, you're going to be in a state of hunger pretty much all day, because there was no sugar to go after, and you've got all of this insulin on board. You've taxed your pancreas more, and as you say, you just drank a bunch of chemicals. There's no sugar in there. It's just chemical molecules that were made in a plant to trick your tongue and make you hungry. Isn't it funny that the people that sell most of these diet soft drinks are fast food places, so you'll be back in 2 hours instead of 4 or 6 hours.
And you can eat some of those nasty carbs they also sell too.
Throwing in there at the same time. And really it is all about moderation, with the exception of drinks, isn't it? America would do so well just to eliminate them from our diet.
It really would. And if you think back, in our generation, if we look at our parents, my mother was a little bit overweight, but she drank soda. She drank diet soda, and a lot of it. She would have 6 cans a day.
Oh.
And I would look at her. I mean, even as a kid, I would say, that can't be good for you. That's not good for you.
And still putting on weight.
And she was still heavy. But you look back and you think, most people in our generation are much bigger than they were then. We used to look at Jackie Gleason and think he was a big man.
Haas, Cartwright.
Yeah. But you walk down the street, everybody's that size now. So, we have to kind of come to a realization as a society, too, that we're really doing damage to ourselves, not just individual people.
I think these sparkling water drinks are going to take over the world because there isn't any sweetening in it. It's not fake. It's not sugar. It's not any. It's just got a little bit of fruit juice in it. It still claims 0 calories. But you end up not going after any kind of other drinks. You can even eliminate a bunch of alcohol just because it's so attractive. It just seems to fit, and it's water.
Well, they are good. There are some pitfalls to that because some people are going to have it in excess. Of course there are. Well, again, it is some of them are sweetened. It can cause a little bit of it can cause a little bit of a pancreatic reaction and have a little insulin release. But also, I think I've read a study that showed that it actually will eat away at the enamel of your teeth.
Oh, great.
These carbonated waters. So you have to be careful with that. They also cause some stomach disorders. If you have a person who has acid reflux, probably shouldn't be drinking that kind of stuff. Just drink plain water.
We hear the word diabetes all the time, and it's. I think some people habituate to it. They don't necessarily see the threat. Leading cause of blindness. Somebody that was pre-diabetic and suddenly slips in diabetes can wake up and see a dark room and never see again. Leading cause of blindness. Leading cause of amputation. And one of the things that it's one of the most terrifying conditions once it gets rolling, because of diabetics feet in particular, if they have to remove a toe, that doctor will tell you, this is not it. It's literally death by 1,000 cuts. I mean, people will lose legs over time. They can lose legs instantly, obviously. And heaven forbid they have an injury, the chances of coming back from that injury once they're in full is greatly diminished. Your healing process is just diminished. There are doctors that say, we can't operate on you, the wound will never close.
Yeah. There's a variety of reasons for that, and meticulous foot care is so important with diabetics. I try to get most of them, when their insurance will allow, into podiatry at least once a year. And it's very important for diabetics to check their feet regularly. Now, I realize sometimes it's hard to do so, especially when you're arthritic or if you're a bigger person, you obviously can't see your feet well. But a clever trick that I'll sometimes tell people is get a mirror and put it on the floor. And you can simply look at the bottom of your feet in the mirror and ask a husband, ask a friend to take a look, ask your doctor. You know, when you go and see your doc, if you're diabetic, take off your shoes when you're in there, take off your socks. Your doctor can look. And never, ever, ever go barefoot. Always wear shoes if you're a diabetic. And it's important because you don't have your nerve sensation is decreased. A lot of diabetics have neuropathy and they can't feel their toes. Also, they don't have great circulation there because it's done damage to the circulation. So they might be walking around the house and they step on a little dog bone, something that was left out, or you stub your toe, like I did yesterday and broke my toe. But, you know, yeah, but
3 weeks is too late to find out that you've cut yourself and you're not healing.
2 days is too much. 2 days. The day that you do something, you have to do something about it. So if you see there's something, address it. Get some dressing, put it on it. If it's a puncture, get into the doctor immediately. Because punctures sometimes can have some bacteria they're injecting.
And that's all an infection needs, and when you've got a compromised immune system, that infection is going to take off. Go ahead.
Just a quick point. I was going to say, and the other problem is diabetics have a lot of fungus, and the feet crack. And that's an entry point for bacteria to get into. So meticulous foot care, cleaning your shoes, wearing cotton socks, these are all things to do.
My mother was a lifelong diabetic. I'll show you a trick. It's a very, very high-tech device. Get a broom, cut off one little strand of the broom, and if you tickle the bottom of your foot and you can't feel it, run to the doctor. Run. Because you have to address that, because you're into neuropathy now.
Yeah, that's actually a modification on what we call microfilament testing. It's like a little fishing line kind of thing, and we
get a broom.
Well, I wouldn't advocate that. I'd say go to your doc and get it checked.
One thing that I remember is that the old days, if they started you on injectable insulin, you were going to take injectable insulin until the day that you died. And now we know that, you know, the doctor would say, take your insulin on time, do something to address your diet, and try to get some exercise. And now, for the last 15 years, it's been exercise, 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 just keep moving, even if it's just around the house, even if it's lifting a can. The movement, it's not that you're lifting so much weight, just the movement of what it does to your cardiovascular system.
Absolutely.
Not to mention what it does to depression. But now doctors say exercise, exercise, exercise. Get on a diet that doesn't include soft drinks or anything white, at least for these first couple of months. And you may very well pull yourself back from diabetes.
Absolutely.
Yeah, and they never thought that possible before.
Absolutely. I always tell my newly diagnosed pre-diabetics, I actually physically stand up and I use a line on the floor. It's usually a crack or a line where the tiles meet. And I purposely put my feet right over the line. And I say to them, okay, I'm like you now. I'm standing at the edge of the Grand Canyon. Out there is diabetes. And right here, back there is safe land. You're falling in there. keep doing what you're doing, you're going to be down there. Right now, you can stand up, take a few steps back, and you'll never be there. And that's the analogy I use because it sticks in the head. And it is reversible. It's just moving. When you're moving, you're burning sugar. And a lot of times people will say to me, I can't walk, it hurts, I have back pain, I have knee pain. And I understand that. I say, okay, get 2 cans of soup, sit in the chair, do some of these, get your arms moving. Just do something. Do some torso rotations, engage your core a little bit.
Throw your mic on the floor.
Throw my microphone on the floor.
You're right.
I'm okay, they can hear me? Okay, sorry. But get it moving. And it, like you say, it also is wonderful treatment for depression. It gets the endorphins in the brain going, and the feel-good those are the feel-good chemicals that we need. And you're burning sugar, you're making blood pump through your heart is getting stronger, it keeps your brain sharper. Everything about exercise is good.
You know, I go to the gym 3-4 times a week.
That's not enough.
And well, it's enough for me right now.
5 times a week.
And the flip side of all of this is that when you're in the gym and you're watching people, they're at their happiest. I saw something, I was doing leg presses the other day, and there's this little New York guy, completely bald. He must have been in his late 70s, early 80s. And this kid that just came off of the court with a basketball under his arm. And the little guy is telling him jokes, and before you know it, there's 5 people standing around, and they're howling. Everybody's just busting up. It's a different mindset. And you look at that man in his late 70s, early 80s, and it's not like he's benching 300 pounds. He's in there, and he's moving. He's doing something. But what else? He's social. And you look at that guy, and you go, that's a guy that's not going to get diabetes. The kid with a basketball under his arm isn't going to get diabetes. All these people that are standing around, it's not that they're cut up. It's not that they're in perfect shape. It's that their cardiovascular is engaged and they're efficient engines, so that they're and the flip side is that not only can you dodge that bullet of diabetes, you may extend your life. I've seen guys in there who are 70 years old, who are bench pressing 300 pounds.
Wow.
Now, they're outliers.
Yeah.
But you look at that guy and you go, when is this guy going to die? Well, it seems almost impossible. They're bulletproof. So you see a lot. There's no way, unless he gets hit by a bus, that guy's going to make 100. And he's going to do it fairly in fairly good order when he gets there. Definitely, you can see a robust mind. You see that interaction. And more important than anything else, they've got grins on their face.
Yeah.
At our office, my office in Tivoli, the second floor, is a big gym. It's a really nice gym. And when I will go downstairs for whatever reason throughout the day, I'll see people coming off of that second floor. And the door opens up. And these people just have big, stupid grins on their faces. And a number of times I've said, I wish I had a picture of every single person that comes out of that gym, because they're just so happy.
It's true. Any kind of exercise, you feel exhilarated. It's a sense of accomplishment, and you find yourself walking around smiling and grinning. If we can, and it doesn't have to be going to a gym. I tell a lot, because some people can't afford it. Some people don't like that climate. I understand.
And you don't need to go to that length.
You don't need to, but as long as you can walk around the house, you can walk around the block, you can get a stationary bicycle. Oh, one of the cool things I tell a lot of my people that work at desks that have sedentary jobs, you can get these little bicycles. They're little pedals. You put it under your desk.
And work it.
And you're sitting there working your legs while you be typing and talking. So it's just or if you want to watch television and just get some leg movement, it's just motion, whatever it is.
Leg movement is particularly important because think of this, if you've got a straw, if you're 6 feet tall, you've got 4 feet from the bottom of your feet, a straw that's that big, and your body has to draw heavier than water, blood, and move it around through your heart. That's a lot of work. But if you're moving, your muscles in your legs are contracting and
pushing the blood back up.
and that's where all the work comes from, and your heart gets a break. So the biggest thing that hit Las Vegas, the biggest thing that hit the United States, but it hit Las Vegas very, very hard, was the entire opioid crisis. A lot of people went onto heroin, and a lot of them won't be coming back. A lot of people stayed on opioids, and they won't be coming back. But there are a lot of people who made it. Nevada made some changes in how you prescribe and what you can prescribe and when you can prescribe. But that means that a lot of people are feeling high anxiety. What is it that you can do if a person no longer needs opioids, but they're in the throes of the remaining addiction?
It's a challenge. It really is. I try to have a conversation with people about it. But people are very, very defensive. And I understand where it's coming from, because it has been so taboo now, and everybody's afraid of being an opioid user and labeled as an addict. And it's not an addict. You're not an addict if you're using it because you have pain and it's needed. What I've chosen to do personally, and I know a lot of my colleagues are doing the same thing now, is referring people to pain management, because it really has become a specialty in and of itself. When do you know that the person does not need that anymore? When is it time to wean? When is it time to maybe increase their pain medicine? Maybe they're not getting to where they want. But this is a specialty in and of itself these days. There are pain management doctors who are very tight in how they are controlling it, meaning patient has to come in, you have to sign an agreement, and even anybody that I have prescribed in the past to, you sign an agreement that you're not going to misuse them, you're not going to sell them, you're not going to take more than you're supposed to, you're not going to run out early, and a whole list of things. Then random drug testing. You come in, and if you know that you're coming in and getting drug tested today, you will do what's appropriate. But if we test you randomly, you don't get your pills if you don't do the random test, that keeps a little bit of control. And the pain management doctors are geared for this. So it's really a challenge. I've personally chosen to not continue to manage long-term chronic pain because it's clearly out of my specialty. If you needed a heart catheterization, you wouldn't want me doing that. I'll send you to one of my good cardiologists that I use and make sure they take care of you. So I think that's how a lot of us are dealing with it. And it's really been an issue. Unfortunately, I have a friend who lost a child and started with a prescription that was given and then went on to other use with heroin. And it's heartbreaking. It's absolutely heartbreaking, and this is happening all over the country. We're seeing 23, 24, 30-year-olds, 18-year-olds dying of opiate overdoses because they found them in the parents' cabinet or somebody had prescribed it. So we really have to be very, very careful of who we're writing it for, and that's important.
You know, one of the gaps that got closed with this is it still goes on, it still happens, and that is some of the people that are most likely to be injured substantially, are young athletes. And for a long time, coaches would send these athletes and say, no, you've got to go to the doc, and they'd end up going to a doctor that prescribed opioids, and that kid would end up addicted. We're not talking, it doesn't take a year, it doesn't take 6 weeks. When you have a young person that has a system that is naive to drugs, it can happen almost overnight, can't it?
Well, maybe, but if a short course of it, if you have a fracture, you're probably going to want something a little more, but usually 5 days is the most you really need it for an acute injury. You can switch to Tylenol, ibuprofen after that. I think most docs now are pretty clever and know what's going on. The last place I had worked at had an urgent care attached, and these urgent care doctors were not writing this. They would give ibuprofen. You have a young kid come in with a sports injury, ibuprofen. You want to reduce the inflammation. You want to work at the problem that's causing the pain. You don't want to just slap a Band-Aid on it. So I think more and more docs have become aware of it, and we're not seeing these young athletes being put on opiates unnecessarily, thank God.
Parents have to keep an eye out for it. In
Sure.
Europe, they do the exact same treatment for the exact same problem with ibuprofen. That's what the first day is, and they report the same pain relief because they weren't taking opioids before. So, lastly, this has been in the news, and now it's been in news in Las Vegas, and that's the vape issue. It looks like there's a lot of counterfeit out there, but it doesn't make any difference whether it's counterfeit or it's this over-the-counter nicotine stuff that younger people are using. There's this giant cloud so that people never hit cigarettes like that, and they'll do this hit like 2 or 3 times in a minute.
Yeah.
And so what do you tell people when they're vaping like that?
I haven't yet. This has only been going on the last few weeks, but I am telling people avoid all vape products for now until we know what's going on. A lot of people would ask me, is it a safe alternative? If I quit smoking, can I vape? And I used to say to them, you don't really know what's in there either. It's not necessarily any safer than cigarettes. But now when we're seeing these respiratory failures that are occurring, there were just 3 cases reported in the paper this morning. And 3 people had severe respiratory illness, all were over the age of 18. So they weren't kids buying it. And what was interesting was one of the 3 had only used nicotine as the vape. And the other 2 supposedly had gotten it from legal outlets. They were using THC-based products, and THC being the active ingredient in marijuana. And they are using that to inhale, and that was purchased in a legal place. They didn't say where. So what's happening in Clark County looks a little bit different than what we're seeing nationally. What we had seen nationally was a lot of cases where they were opening up the cartridges and putting in other additives like vitamin E. Like those 2, there were 2 people that were arrested. They were running a business. They were manufacturing the stuff out of an apartment.
30,000 units a day, they said, selling at $35 gross, put them just over $1 million a day. The vitamin E acetate has confused things a lot because these doctors are saying you're seeing this fatty deposit on the lungs, and now they're saying that might be the body's defense mechanism because you're an ongoing vape machine. But it is scary. I think that there were high hopes that vaping might get people off of cigarettes, and instead it ended up being a problem of its own.
Well, hopefully people will not use any for the time being until,
figure things out.
Yeah.
So if people do want to get in and see you as a doctor, how do they reach you? How do they find you?
Well, I'm going to be at Forte Family Practice. They have 2 locations currently, and I will be at Tropicana and Rainbow. You can find me on Facebook, Dr. Laura Addis, and I have information and how to call for an appointment. I can get patients in the same day.
That is very handy for those folks living out there at Spanish Trails, right across the street, right?
That's right next to us, yes.
Cool. With that, it's time for us to wrap up the InBizLV Podcast, your soon-to-be favorite business podcast dealing with all kinds of developments in the Las Vegas business community. I want to thank you, Dr. Addis, for joining us today, for taking care of Las Vegas patients, and for taking care of me, too.
Well, thank you for having me.
I'm Mark Fierro, president of Fierro Communications, the friendliest marketing firm in Las Vegas. Remember to like and share the InBizLV Podcast on Facebook. Also catch us on YouTube, iTunes, or my personal favorite, Stitcher. If you rate us, it will help people find us. And for all of you entrepreneurs out there, if you have a story idea, hit us up at 702-385-7300. Share, follow, like. We're out of here.